This video will demonstrate the use of the masking assistant available within Measure. Using the masking assistant allows organizations to set standard masking protocols and ensure they're followed by all providers. With the masking assistant, hints can also be enabled to remind providers of appropriate masking procedures. Open Measure and select Audiometry. Perform the pure tone assessment as per local guidelines. Once a pure tone threshold is stored and masking is necessary, the user will be alerted with a dialog box. The provider should then select Yes to begin masking with the masking assistant. The masking assistant will then automatically present noise to the non-test air at the appropriate level. To present the pure tone stimulus, simply hover over the stimulus button. Select heard or not heard based on the patient's response. When heard is selected, the masking level will automatically increase by the preset recommended level. This level is preset by the Measure software administrators and should be in line with local guidelines for audiometry. Note the masking assistant box to the right-hand side of the screen. Exclamation points are used to alert the provider that masking is needed at the indicated frequencies. Providers can manually open the masking assistant by double-clicking these indicators. When the plateau is reached, the assistant can auto-store the threshold, or the clinician can select the store option using the same technique as when assessing the air conduction thresholds. The masking assistant can also be used during bone conduction testing. Here, the air bone gap is set to require masking when there is a difference of 15 dBHL or more. When thresholds have been determined and masking completed, the audiogram can then be saved.